Welcome back. So today I would like to present for this module Pharmacology 1 PHPG 4122, and my title is How to Use Antacid for Patient with Have Hypertension, and my name is Mariam Balkis binti Azhar. My matrix number is 320-4120-3008, and I am from DPH 17. So my lecturer name is Madam Mazwin binti Kamis. So this just about me. I skip a little bit. I am in my early 20s, so guess my age. Yes, you have got it wrong. I am 20 years old. Before you guys hate me more, I am KPJ International College Pinning Branch student. And this is my outline presentation, introduction to antacid, classification of antacid, side effect antacid who are not suggested to take antacid. Oh, might scary. And what is hypertension, how to use antacid for patients which have hypertension, dose for antacid taker, proton pump inhibitor (PPI), and the conclusion. So this is introduction about antacid. What is antacid? Okay, they have a picture, just a example. So antacids are medicines that counteract, neutralize the acid in your stomach to relieve indigestion and heartburn. They come as a liquid or chewable tablets and can be bought from pharmacies and shops without a prescription. So this is common types of antacid. Many different types of antacid are available. Some are sold under a brand name and others are named after their main ingredient. Brands include Gaviscon, alginic acid, and Pepto-Bismol. Bismuth subsalicylate. Ingredients to look for include aluminum hydroxide, magnesium carbonate, magnesium trisilicate, magnesium hydroxide, calcium carbonate, and sodium bicarbonate. Some antacids also contain other medicine, such as alginate, which coats your gullet with a protective layer, and simeticone, which reduces flatulence. Okay, next is side effect. Anything we take in this world have side effect. So most people who take antacid do not have any side effects. However, side effects occur in a small number of users. The most common are diarrhea, constipation, and blood belching. Magnesium-containing antacids tend to be laxative, whereas aluminum-containing antacids tend to be constipating. Antacid contain both magnesium and aluminum, may balance out these effects and so minimize any possible side effects of diarrhea or constipation. For a full list of all the side effects and possible interaction associated with your medicine, consult the leaflet that comes with your medication. If you are taking antacids, you should avoid taking them at the same time as you take other medication. This is because antacids can affect how well other medication is absorbed. So next is who may not take antacid. So antacids are safe for most people to take, but they are not suitable for everyone. First, who are pregnant or breastfeeding. Most antacids are considered safe to take while pregnant or breastfeeding, but always get advice first. Second, who are looking for a medicine for a child under 12 years of age. Some antacids are not recommended for children. Third, who have liver disease, kidney disease, or heart failure. Some antacids may not be safe if you have one of these problems. Yeah. And fourth is who have an illness. That means you need to control how much salt, which is sodium, in your diet, such as high blood pressure or cyst. Some antacids contain high levels of sodium, which could make you feel unwell. Yeah. And the last, who are taking other medicines. Antacids can interfere with other medicines and may need be avoided or taken at a different time. So next is, what is hypertension? So actually hypertension coming from what? So hypertension is high blood pressure and also called hypertension. It's blood pressure that is higher than normal. Your blood pressure changes throughout the day based on your activities. Having blood pressure measures consistently above normal may result in a diagnosis of high blood pressure or hypertension. So it can lead to severe health complications and increase the risk of heart disease, stroke, and sometimes maybe death. Oh, and the last, so how can we know the normal blood pressure level and for hypertension patient level of blood pressure? So normal blood pressure for adults like we, more 120 to less than 129, the BP only. So, but for the hypertension patient, their blood pressure usually more than 140 to just higher than 190. Yeah, it can reach like that. It's very scary. So we need to take care of ourselves. And then, so we know that just now we talked about hypertension, antacid. So actually how to use antacid for patients that have hypertension. So we look at this. We need to know lah. The first one is dose for antacid taker. So first, average therapeutic dose 10 to 15 ml of liquid or 1 to 2 tablets for 3 to 4 times a day if we need to take it. And then the second one is aluminum hydroxide antacid for oral only. Okay, so 640 mg 5 to 6 times a day suspension, and then 320 mg over 5 ml. So you need to calculate later. Okay, the third one is calcium carbonate antacid dose. Less than 2000 mg per day. So do not reach that. Yeah. Okay. The last one is proton pump inhibitor, PPI. So proton pump inhibitors are used for the prevention and treatment of antacid related conditions such as stomach ulcer, gastroesophageal reflux disease, GERD, GERD, and the last one, hypertension. Actually, more than this actually, but I take three main. Okay, so what are PPIs used for? Proton pump inhibitors are used to relieve symptoms of acid reflux. I'm sorry, or gastroesophageal reflux disease. GERD. So this is the picture where you can see the PPI react to our body. So next is proton pump inhibitor also. So GERD, antacid therapy once daily with PPI. So for stomach ulcer, antacid therapy twice a day with PPI. So this example medicine for PPI. We can see Nexium, Zejuric, Prevacid, and Prilosec. This actually, if not, I am not mistaken, all OTC product. Yeah, I'm sorry. And then the last one is conclusion. So, antacids are useful to provide rapid relief of intermittent heartburn, particularly if brought on occasionally, sometimes by foods or various activities. Antacids also seem to help many of those with bloating or functional non-ulcer dyspepsia by reducing gastric acidity, which is raising the intragastric pH level. Antacids inactivate pepsin and relieve symptoms. I'm sorry. Over-the-counter preparations provide only temporary symptom relief. They do not prevent recurrence of symptoms or allow an injured esophagus to heal. Most commercial antacids come with some instructions. It is very important to heed the contraindications and not exceed the recommended daily dose. Just follow your physician, what your physician talks to you. Okay, so thank you very much. And I do like to read a quote. They may forget your name, but they never will forget how you made them feel. So thank you. That's all from me. I am very sorry is my voice not clearly, but you can understand it from my slide. I write it all on my slide. Thank you very much.